today, Peter DeSantis, who will be talking about, of course, as you know, the history of medical care in Marathon County. And many of you will know him from his association for many years with North Central Healthcare. So let me put up the screen quick. Hopefully I can do it quick.
The introduction is longer than the speech.
Well, that's okay. I'm going to be fighting with this for a while. He said not to do that.
I'm a little nervous when a woman with a pulpit. You'll have to forgive me. It's really an honor and a privilege to be here today to talk about the development of healthcare in Marathon County. I'm beginning to feel as old as the remodeled room we're sitting in today. But just to give you an overview of the area we're talking about that affected Marathon County, I think all of you know where Town Line Road is. Well, on top of Town Line Road was the first poor farm, as it was called then. It covered all of that land that most of East Hill is built on. From there, we went to the Sturgeon Eddy Road. All of the land that surrounds Sturgeon Eddy, Marshall, the airport, that was all part of the complex, including the river, the lake. No one realizes there's an island halfway between what's called the Insane Asylum Point, which is the end of the airport, and Bluegill Park. Bluegill Park was also part of the county institutions. And I went from Bluegill Park out to the industrial park. Most of the industrial park was also part of the complex, including where Man-Made Lake is today, known as Sunnyville. That was part of it. And on the other side of the highway, there was a large hill which we gave to the, I think it was the municipal airport, so they could use it for model planes. So you can see the geographical area that was involved and how it transitioned over the years. The county first became involved in the late 1800s, and as it was called the Poor Farm. It was really not a poor farm. It was just a place for individuals who had nowhere to go. It provided basic room, board, and basic medical care. A local physician from the community made weekly visits out there. And that facility stayed there until they built Sunnyville Infirmary, which was next to the county insane asylum. And that was its name, Marathon County Insane Asylum. The nursing home, something I didn't even know about. And I can just see I'm in for trouble. Some people just walk in late, but that's okay. I won't point her out. But once you're a nurse, well, you can't live with them. Anyway, getting back to the insane asylum, next to it, when they built Sunnyville, the second floor was a general hospital. Very few people realized the county was in the general hospital business. They had a surgical wing, a dental wing, full lab, full x-ray. And that was a wooden construction. And it was connected by a wooden tunnel between the healthcare center and the county insane asylum. And somewhere the wires in the attic crossed and it burned down. And I think we had 127 residents at that time, and they were all moved to the hotel downtown Wausau, which is now where the Y is located. The building was replaced, and at that time, the surgical unit was phased down, and they opened up isolation rooms. There were no isolation rooms in any of the hospitals at that time. So the county filled that gap. And that's what you'll see happened over the last 125 years. The county has filled mainly gaps in service areas. And as other agencies or organizations came forth, the county then changed its direction to meet the growing needs of the community. It was a very costly operation at that time. I think the weekly operation cost was $1.50 a week per patient. Well, I try to get something for $1.50 today. It was interesting, mainly the reason it was so, costs were kept so low is the county had its own garden, its own herd of cattle, milking cows, pigs, chickens, you name it, they had it. They had a big slaughterhouse. That's probably why the county board always approved everything they needed, because they would pull up with their car or their truck and load up for the winter. It was called payola, I think. At that time, Dr. Rosenberg was the medical director. And let me give you a quote from him, because I think it's something that has stayed with the county. No greater humanitarian effort has ever been made by Marathon County than the equipment of the hospital department. And as time passes, the community will find a place with pride and joy, and knowing that loved ones will be taken care of. The staff in 1916, the employees were provided with 12 yards of material every 6 months, so could they build their own, they made their own uniforms. Things got a little better later on. It took quite a while. The home and hospital, as I said earlier, were connected with the farm. And most of the residents worked out on the farm. The cattle were driven across the lake when the dam was closed, the water was lowered. They would take the herd of cattle across to Bluegill Park and drive them out to where the farm was located at Sunnyvale. The reason it's called man-made lake is that when we were building the healthcare center, we needed landfill. So we made a deal with the Department of Transportation, and they were using the landfill for Highway 29 project. And they, of course, they hit water, and that's, we made a deal with the Park Department. If they would develop it, we would turn it over to the Park Department so it could be used by the county, and not just for the farm. And here he comes, slow but sure. My favorite senator. A lot of what we have today is due to that gentleman and his efforts in the legislature. He told me to say that. Hi, Walter. After the Sunnyvale was burned down and it was replaced by the brick structure that is there today, and it was converted into a nursing home. I think there was about 157 beds at that time. And it remained that way until the 70s. At that time, also the Insane Asylum, which was primarily, if you were mentally ill, you were transported either to Winnebago or to Mendota in Madison. If after treatment, it was considered that you were chronic long-term, you were then transferred back to Marathon County And there you were provided with basic care. There was no treatment as we know it today. It was basically good, solid nursing care and room, board, and almost everyone was involved in some occupation. But as time grew, the building became outdated, and the state issued condemnation orders that had to be either closed or replaced. A citizens committee was appointed to look at what the future should hold, and John Slayton was chairman of that committee, who did an outstanding job. Their report recommended that we move into a new era of treatment rather than just custodial care. I was a member of the Citizens Committee at that time, and I was graciously kicked off the committee when I kept suggesting that before you build a building, you better know what you're going to do with it. And you better know what the treatment program is going to be and what it's going to cost. Well, much to my joy, when they said goodbye, I said, good, I'll go back to the workshop where I belong. That lasted 1 week. When the county came and they followed my direction, they hired a new board of directors, but most of the directors were from the workshop. And so they made a deal with my board. They said, if you want Peter to stay, he has to work for us half-time. So when I came back to work one morning and I found my assistant moved into my office, and he said, why didn't you tell me you were quitting? And I said, I'm glad you told me. I think I was the only one promoted to a position that didn't have the qualifications. But we had the vision, and we had the ability to go out and get federal grants, and that's what really saved us. The funding of those programs were unbelievable. I think the first 5 years we brought in something like $15 million in federal funds that would have had to been picked up by the taxpayers. So with that amount of money, we were able to go out and hire a tremendous number of qualified staff. And that's what's really built the healthcare center, was the quality of the staff that we were able to attract on all different levels. The healthcare center consisted of basically 3 main programs. One was the county hospital. The second was the guidance clinic for outpatient care. And the third was a program for developmentally disabled. The staff grew from 40 to 800. Volunteers grew from 100 to 600. And patient care rose from 150 to 7,000 a year. So we saw a tremendous amount of growth and development in the facility. At the same time, Lincoln and Langley County came forth and wanted to be partners in it. And it made sense to regionalize it because some of the clinical help was very difficult to get. And by sharing them, we were able to be more effective in recruitment. And we were able to do some areas that are still viable today with the cooperative effort of Aspirus. We were able to bring in the first physicians in rehabilitation medicine. And they have grown from 1 to several in the community. Something that very few people don't know is that the hospital was supposed to have been built alongside of the healthcare center. The plans were, because the county owned the airport. The county still owns the airport. It's under a lease agreement. But it was a vision of Leroy Jonas and several other county board members. that be an ideal location to start a medical complex. The only problem was access, and that was being worked on with Department of Transportation to build a bridge on the south end to connect with 51. But at the same time, Wassa Insurance came up and said to the hospital, we want you to build out here. So Wassa Insurance donated the land to Aspires. And even to this day, there's a number of working relationships that exist between the two facilities. And I think that's what's important, is the development of these working relationships over all these years. When the center opened, and we were able to get, as I said earlier, these federal grants, a number of problems arose. One is there was no such thing as a special hospital, and that we had no license to operate to collect insurance, and no one knew about it. So we had to develop the first application to develop a special hospital license through our legal counsel, Bill Hess. He not only wrote the application, he wrote the rules that govern the application for the state, and he wrote the application itself and carried it through. So we were innovators in a lot of different ways, but we also had to get it through the legislature because there were no laws that allowed it. So that's where one of the many things Walter John did for us was to get the legislation that we could pass that kind of rule. The other thing that happened is the state came in one day and said, these patients are no longer mentally ill. We said, what are you talking about? They said that there are now nursing home patients who are not mentally ill. We're using the new federal definition so we can capture federal money. Well, the only problem is the state could do whatever they wanted, but they were still mentally ill. And there was no funding we could collect. So again, through the efforts of Walter John, we got the laws changed. And we were able to manipulate. And manipulate was a key word in those days. We were able to manipulate the system to get the law changed. So we were able to keep them properly diagnosed and treated. But in order to do that, we had to play a silly game. We had 3 nursing home licenses. And the state said our population was over 50% mentally ill, so you still can't get the funding. So we said, okay, so we built a new Mount View Manor, and we attached it to the healthcare center with a corridor. And then we went and we eliminated our 3 separate nursing home licenses and ended up with 1. And we said, now we got you. Our percentage is below 50%, so they're still mentally ill. So the funding was able to go on. And I think you can see politics and the political system have a significant impact on how you operate. Another interesting point was that there are a lot of federal grants out there that we were not eligible for because we were a federally operated program. I'm sorry, private grants that we couldn't get because we were federally operated. And we were the only federally approved center in the state of Wisconsin. So it was a two-edged sword. So what we did is we created a foundation, North Central Healthcare Foundation, which is a private, non-for-profit foundation. They're eligible to apply for private grants. And through their efforts then, the first grant we received was for a group home. And that's when we moved the first group, 16 patients out of the healthcare center into the community. That one home grew to 16 homes located throughout the community. And it spurred a number of private agencies, primarily Lutheran services, to build group homes. So we were able to transfer a lot of people from inpatient care long-term. You couldn't even measure the length of time people were there, it was so long. To when we finished, the length of time was more like 3 months. But the most important part of that was to have a community support program and a strong group of people in the community that supported what we were trying to do. One of the grants we were able to get on the private, how it affects others, was for domestic abuse. Some women think I'm a male chauvinist. I won't indicate who she is. But I think I got that grant just to show her that I was a sweet old man that loved her. And through that grant, we were able to conduct a study to prove the need for domestic abuse services in this community. Once we got that approved, we were able to get another grant which funded their program for a year to get them up and running. So we were very, very proud of being able to do that, especially on a personal basis when you go yeah to somebody. I'm not going to pick on her anymore. One of the many interesting things that have occurred over this period of time was the support from the community. League of Women Voters, God bless them. They were instrumental in getting a lot of these programs started. They did a community study on what is going on with mental health and general health for people with mental illness. And through their efforts, they were able to get the support of the local media, TV, and newspaper. And through their support, we were able to get community-wide support, statewide support, and even federal and international recognition for the programs and services that were done. Again, none of these things could have been accomplished without the county board's support. You know, people moan and groan about the politics today, but I think what's missing is openness and honesty, because never once did we have a problem with the city council or the county board in any of the counties. As long as you go to them and you're open and you're honest and you tell them what you're trying to do, if you tell them when you fail and why you failed, they're always there to support you. And their support has been unwavering throughout the years. None of this could have been done without them. And I just wince when I pick up the paper and I see people more interested in promoting themselves than they are in promoting what's good for the entire community. And we were fortunate that we came on board at a time when the attitude was much more positive, much more open than it is today. Hopefully we can move back in that direction. I think I've hit most of the highlights during this time. I'd like to leave some time for some questions if you have any. I usually do such an outstanding job, gentlemen, and yes.
Thank you, Peter, for your presentation and all that you've done for the community. You've touched many families here and our ancestors as well. Would you be able to talk about the treatment of tuberculosis in the county and maybe how that was handled by the county if possible?
Can I give you the mic?
The question was about, could you hear him all right? Could you hear the question? No. Okay.
Can't hear it. Which one of you is faster?
Question was about the history of treatment of tuberculosis patients in the county. Is that properly summed up? There you go. The tuberculosis sanitarium.
Oh,
Can you talk about that a little more?
forgot the most important part. I know to use the mic.
Can you please use
The
the
tuberculosis sanatorium, which was built out on where man-made lake is. And it was the first, I think it was in 1915 it was built. And it was the sixth tuberculosis sanatorium in the state of Wisconsin. And at that time, the primary care for TB was rest, sunshine, fresh air. Later on, medicine stood up and made big advances in its care. Dr. Willer, who was the physician there, when he died, he left $50,000 to the county to be applied towards a wing for children. The county stood up and matched that. I think they put in 80,000. And we had the first children's TB sanatorium. Along with an interesting side note, we also had a railroad station located right down at the foot of the nursing home. There was steps, lights, and then the station itself. And I think it was 15 cents for a ride into Wausau. So a number of residents were able to go out, could take the morning train into Wausau, and then I think the evening train came back around 6 or 7 o'clock in the evening. The sanatorium stayed in existence until the late 70s, and at that time it was phased out because modern medicine had pretty well eradicated the need. Unfortunately, we've seen a rise in tuberculosis, and there's been some concern and some desire that the county consider looking at it again. And at this time, I think it's a little too premature for the county to get involved. But it did fill a gap for quite a few years out there. Yeah.
At what point did the healthcare system go from providing support and daily assistance to people with mental health issues to actually diagnosing and treating?
Okay, translating. At what point did the county go from treating mental health issues to actually diagnosing the issues?
To supporting the patient or supporting the person to actually
Okay.
diagnose and treat.
At what point did they go from supporting the person, as you mentioned, to actually diagnosing the issues?
Where did they go?
When did it become less support and more diagnosis and so forth? This is usually
The big change came in.
Can you use the microphone? Otherwise, the guys in the back can't hear you.
Okay.
Thank you.
The big change came, I should say, in 1972. And the reason it was, what happened is Wisconsin legislature passed a law called 5142, which mandated counties to provide basic mental health services, which included emergency, inpatient, outpatient, day hospital, community consultation and education, and partial hospitalization. I think those were the keys. They also created another statute called 51437, which was a separate service system for developmentally disabled. At that time, Marathon County had about 225 residents who were at Northern Colony. And the object was to get them moved back into the community. But what it did, it created a duplication of the existing services and a duplication of board and administration. So we worked very hard with our state senator again to get the law amended so the county could do it either separately or put it all together in one system. And we lobbied to get it all under one system because it didn't make sense to have more administrators and less people providing treatment.
I'm thinking about bipolar disease, and is that considered a mental disease? Bipolar and other such problems?
She's asking about bipolar disease
Primarily, but there are other.
and others similar. Is that considered,
Are they considered mental diseases?
are they considered mental diseases?
And if so, where are they considered medical diseases?
When you say where?
Well, is there a place for them to go to get help?
Oh, okay. She wants to know about bipolar disease. Is it considered a mental disease?
Yeah,
And if it is, where can this be treated?
right.
There we go.
It used to be called schizophrenia,
That's been broken into several.
and then they diagnosed it into bipolar.
And another one too. there's-
You know, the primary, at one time, the only place you could get treatment was in a state hospital.
Yeah.
The county, when I left, was providing both inpatient and outpatient services for bipolar.
Really?
There was a reduction in services for some reason afterwards. But I know a number of private agencies are dealing with the issue on an outpatient basis. But for a lot of them, it does require some short-term intensive hospital care. And I think the healthcare center is moving back in that direction because there is a gap in the service for them.
Well, it's considered, my daughter is bipolar, and she is considered disabled because she can't pay attention to a job lot. Now, she's very bright, extremely bright, as a matter of fact, but she cannot, that problem of bipolar is like a noose.
When did the units for dementia patients get built? Were they converted from something else? I think the C wing and the E wing are. When did the units for?
I got it. But you're very good.
She wanted to know when the wings or units for the dementia patients were built. She thinks it's C and E wing. Is that correct?
C and E units, yeah.
C and E units, yeah, when were those built? When were those created?
Well, you know, it's interesting because we put a lot of labels on that. Everything from hardening of the arteries, dementia, Alzheimer's, everything was thrown into one pot. And very few people knew anything about it we were blessed that when Dr. Rhodes, Bruce Rhodes, who was one of our psychiatrists, very interested in working with the elderly, and he was one of the first ones to pioneer the fact that Alzheimer's is different than dementia. Dementia is different than heart. There is a difference, and the treatment is required differently. And he developed the first inpatient unit for dementia. And I think it's still operating. But it's a growing problem as we all get older. Except for me, I'm not there yet.
Do they do electroshock therapy there?
She wants to know if they still use electroshock therapy.
Electric shock therapy was really in the primary therapy of the 30s, the 40s, and the 50s. And then it went out of favor for many years. They found the need that certain people with certain problems benefited from shock therapy. And they reintroduced it. It's been done, and it's being done on a very limited basis. Yeah. But it's not like one flew over the cuckoo's nest.
Any other questions?
What year was the pool built? And what do you know about it now? And, you know, I'm just interested in any comments about the pool at North Central Healthcare.
She'd like to know about the pool that is at North Central Healthcare. When did it come into existence, and what's its future?
My favorite topic. Well, let me give you a little history, because when we built the addition to the healthcare center known as the Each Building, I went and I met with the school district, the Y, the university, everyone I could think of to see if they would be interested in a joint project, or if they would do it, we would help raise the money for it. At that time, no one had any interest in it. And I really felt that it was something that would be extremely beneficial if and when we could ever get the message out to the medical community that water therapy has a tremendous benefit for patients. I'm really happy that it happened even after I was gone. When I left, we only had about 4 or 5 doctors making referrals. Today, they have over 100 physicians making referrals. The number of people using the pool has just dramatically increased. There is a need to bring the pool up this par. It's outdated, but I think there's this committee that's been appointed, and they've been looking at various options. The options range from remodeling the present pool to someone hallucinating, wanting to build a $9 million facility. But I'll go on the record, I think they're nuts. $9 million, I don't think the taxpayers can, at this time, can handle that. If there's a more efficient, economical way to do it, they should be looked at. There should be plans, should be coming out next month to the county board as to the recommendations of that committee. A lot of members on that committee I know are strongly in favor of a circular pool with a dome ceiling that carries a $9 million price tag. A lot of the problems, and I'll probably get shot for this, is that if you had good maintenance, good housekeeping, we wouldn't be facing half the problems we're facing now. You gotta take care of what you have first. There's so much demand on the taxpayers as it is. Yeah, I think if we show them we're frugal, we're careful, but we're showing them the tremendous need. Who would believe the number of people with arthritis that are in that pool today who are able to ambulate and get around because of that pool? So it's a real blessing. So you will need to talk to your county board official, but I think you'll find the county board, when it comes to healthcare, has always been very open and very receptive. Speaking of county board.
Yes, I know. So, Peter, this has been really very interesting. I was just wondering if you could provide for us, given your rich history with this very important entity in our community. First of all, what do you see as a priority for the future of the needs of this community that we should be aware of that maybe isn't well known in the community? That's one question. And then the other is what has been the role for North Central regarding youth, and where are we today, and what is the need for youth, whatever age? And I'm not sure of the history of North Central's treatment and care for youth, but we know that that's a bit of a challenge right now. If you could speak to those issues, thank you.
What she asked, and correct me if I'm wrong, is what is it that the community needs in the future, even if it's not a well-known type of thing? What is it that you feel the county needs as far as healthcare, et cetera? And the second part is something I'm very interested in, is where are we at with care of youth and mental issues? It's been a challenge. Where are we going from here? How are we solving the gaps that are out there? Did you get all that?
Summarize that.
Where should we go, and what about the kids?
Where should we be going?
Yeah.
Wow.
Sort of an open-ended topic there.
Hindsight is a great thing, but being able to project the future is even a little bit more difficult to do. I think the county has to stay in a role that is not being filled by someone else or by the private sector. But you gotta be careful, and I'll be real honest about it. The private sector, when we built Mountview, did everything in their power to stop us from building it. And the reason why is they said, we'll take care of everyone. They said, fine, then stop sending us people at midnight who you call disruptive, and you call the sheriff's department. They bring them in under an order of safekeeping, so we have to admit them to the psychiatric unit. Once they're in there, they're evaluated. We determine there's nothing wrong with this person. They're like my hearing. They lost their hearing aid, and that's why they were yelling. This is a true story. We said, we'll bring them back in the morning. Oh, we're sorry, the bed is gone. We said, what do you mean the bed is gone? Well, someone else took it. And what had happened is the private funding ran out, and the person was going on medical assistance. And medical assistance doesn't come anywhere near paying for the cost of it. And that game still goes on. And I think we have to be very careful that an individual that falls into that crack doesn't fall all the way through, that someone's there to take care of them. And that's been the county's role, is to fill that gap that no one else does. And I think that with the remodeling they're doing now, is positioning themselves for at least 20 years. That if you're not looking at a minimum of a 20-year plan, you shouldn't be doing it.
And then she also asked about youth services. Her second question was about youth services and how are we going about filling the gaps that are out there right now?
Would you like to say something?
Here, I'm just enjoying this.
The grilling?
I was telling one of the gentlemen earlier, one of the things that we can be very so proud of is the building we're sitting in today. When we first came to town, the first event we ever attended was a reenactment of Civil War. And at that time, it took up a whole half a block. And I think there were a dozen people there. And to see what has transpired over the last 30, 40 years with the Historical Society has just been outstanding. And I think you need to be commended, because this is what's made us a good community to live in. So I thank all of you for all your efforts. Thank you.
Oh, do we have time for one more question? She has one more question. I'm sorry.
My question is, I have been looking at some death records at the courthouse, and there were a number of references to burials in the asylum cemetery. Oh. What happened to it? Are the bodies still there?
Where is it?
I don't know.
Okay, are you ready? She was researching records at the courthouse, and many of them, or several of them, made reference to burials at the asylum cemetery. She wants to know, is it still there? Are the bodies still there? And if not, where are they? You think it's still there? The asylum cemetery?
Oh, don't bring that up.
I think we're done talking. So do you want to answer?
She. How did you find out about that? I found out about a guy on a bulldozer who was out there working on the parking lot and called me and said, I think you better look at this. And we found it in the asylum cemetery. And so we worked with the local undertakers, and a number of those remains that could be found were relocated.
Do you know where?
But we never talked about it.
Do you know where they were relocated? She wants to know, do you know where they were relocated to?
Well, I'm sure I can find that out for you.
Okay. All right. Well, thank you very much, Mr. DeSantis. We appreciate you coming. And please don't forget to fill out the survey. Remember, it's less scary